Test. Test. Tu yang metrik. Test.
Test mic 1 2. Mic 2, mic 2, test, mic 2,
Test.
test. Test mic 1 2, test. Test mic 1 2. Test 1 2 3. Test 1 2 3. Test mic 1 2. Test mic 1 2. Percubaan suara 1 2 3, test. Test mic 1 2.
Semua tak bunyi. Semua tak bunyi. Semua tak bunyi. Tes.
Ladies and gentlemen, please rise for our arrival of Professor Dr. Kamarul Ariffin and our distinguished guests. Please. Ladies and gentlemen, please remain standing for the singing of the national anthem Negaraku, followed by IIUM anthem leading the way.
the future, share the wisdom to the spirit of Islam. Revelation and reason shall excel, shall prevail. Merging faith and knowledge, we, the Khalifa, we will fulfill the Amana. Together we make the world a better place. Forever expand the culture of Iqra. IIUM is to realize the meaning of Ramadan lil Alamin. Together we make the world a better place. Forever expand the culture of Iqra. IIUM is to realize the meaning of mercy to all worlds for mankind.
Thank you. Please be seated. Before we proceed, may I have your attention to the front screen for a brief safety announcement.
May we have your attention, please? This is a public safety announcement. Assalamu alaikum wa rahmatullahi wa barakatuh.
Welcome to International Islamic University Malaysia, Kuantan campus. You are now in the Grand Hall.
Upon the sound of a fire alarm or when evacuation order has been issued, please evacuate the building immediately. Emergency situations can be triggered by the presence of potential hazards such as fire and natural disaster.
This hall has 9 main emergency exits.
Please take notes on emergency evacuation routes, locations of exit doors and staircases. Exit signs will remain illuminated at all time. Please take a moment to locate the nearest exit to you. During evacuation process, please remain calm and walk to the nearest exit according to predetermined evacuation routes. For faster and safer evacuation process, please refrain from talking and running. Once you are outside the building, please proceed to the nearest assembly point and wait for further instruction. Thank you for your attention. This message is brought to you by IIUM Safety and Health Committee. Safety is as simple as A, B, C. Always be careful.
A very good morning, Yang Berusaha Assistant Professor Dr. Iskandar Bahari, Assistant Campus Director IIUM Kuantan, Yang Berusaha Professor Dr. Samsul Draman, Member of IIUM Board of Governors, Yang Berusaha Professor Dr. Muhammad Azdan Mat Aris, Dean of Kuliah of Medicine, Yang Berusaha Professor Dr. Kamarul Ariffin bin Khalid, Yang Berusaha Associate Professor Dr. Ahmad Fazli Sulong, Head of Department of Orthopedic Traumatology and Rehabilitation, Kuliah of Medicine, Professor Datuk Dr. Ahmad Hafiz Zulkifli, Senior Consultant Orthopedic Surgeon, Professor and former Professor of Orthopedic Department Traumatology and Rehabilitation, Kuliah of Medicine, Professor Dr. Edward Ma, Professor Dr. Muhammad Abdul Razak, Dr. Jane Chang, yang berbahagia Dato Seri, Dato, Deans, Director, Deputy Deans, Head of Department, Professor, Associate Professor, Doctors, distinguished guests, ladies and gentlemen. A very good morning once again. To seek blessing for this event, may I invite Dr. Muhammad Noaza from Kuliah of Medicine to lead us in the recitation of Dua. Please welcome Dr. Noaza.
We will start with Ummul Kitab Al-Fatiha. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. In the name of Allah, the most gracious, the most merciful. All praise is due to Allah, Lord of the world. May peace and blessing be upon Prophet Muhammad sallallahu alaihi wasallam, his family, companions, and all who follow his guidance. Allahumma ya Hanan ya Mannan, we humbly express our deepest gratitude to you for granting us the opportunity to gather today for this distinct hand from divine design to surgical mastery. We are humbled by the knowledge through which we learn, heal, and serve others. Grant us wisdom, sincerity, and humility as we seek beneficial knowledge and strive for the excellence of our profession. O Allah, bless Professor Dr. Kamarul Ariffin bin Khalid for his dedication to teaching, research, and patient care. Reward him abundantly, grant him good health and continuous success, and make his knowledge a lasting benefit for all. O Allah, let this lecture be a source of inspiration, enlightenment, and meaningful reflection. May the knowledge shared today contribute to the advancement of medical education, scientific discovery, and patient care, and may it benefit our institution, our nation, and the wider global community. Bless all who are present today. Unite us in the pursuit of knowledge, compassion, and service to humanity. Guide our mind, steady our hands, and place barakah in all our effort to care for those entrusted to us. Rabbana zalamna anfusana wa illam taghfir lana wa tarhamna lanakunanna minal khasirin. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Wa sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi wa baraka wa sallam. Walhamdulillahi rabbil alamin. Amin ya rabbal alamin.
Thank you, Dr. Muhammad Noaza. Ladies and gentlemen, I am Lim, your MC for today's event. First and foremost, on the behalf of organizing committee, I would like to extend a very warm welcome to all of you for joining us today. Today is 25th June 2026. We are grateful to God for allowing us to gather here for this professorial lecture. We are honored to witness the lecture by our esteemed professor from IIUM Kuantan campus, Professor Dr. Kamarul Ariffin bin Khalid, who will be delivering his professorial lecture in this honor hall. All praises and thanks be to God for his blessing and mercy in bringing us together for this meaningful occasion. Ladies and gentlemen, may I invite Professor Dr. Muhammad Azdan Madaris, Dean of Kuliah of Medicine, to deliver his welcoming remark. Please welcome Professor.
Okay, Bismillahirrahmanirrahim. Thank you, MC. Assalamualaikum warahmatullahi taala wabarakatuh, and very good morning. Respected Professor Dr. Samsud Rahman, the members of Board of Governance IUM, Assistant Professor Dr. Iskandar, the Assistant Campus Director and also representing of the Campus Director, Center of Natural and Health Science, IUM Kuantan Campus, Assistant Professor Dr. Fadli, the Head of Department of Orthopedics, Professor Datuk Dr. Hafiz, Professor of the Orthopedics, Professor Dr. Ma, our invited guest from Australia, Associate Professor Dr. Ahmad Mazuki, Deputy Deans of Postgrad of Kuala Medicine, Head of Departments, Professor, all the invited guests, and all IUM students and also all IUM Kuantan campus staff. Okay, Alhamdulillah, it's a very great honor and privilege to welcome you all to these significant academic occasions, the Professorial Lecture by our Professor Dr. Kamarul Ariffin bin Khalid, with the topic entitled The Human Hands from Divine Design to Surgical Mastery, Reflection on Biomechanics, Surgical Practice and Medical Educations. Today's gathering is a significant academic occasion as we celebrate not only the scholarship achievement of one of our distinguished professor in Kuala Medicine, but also the pursuit of the knowledge that lie at the heart of our university missions. The Professorial Lecture is a platform that allows us to appreciate the intellectual contributions, the professional expertise and lifelong dedication of our professors in advancing education, research, and service to societies. The title of today's lectures invites us to reflect upon one of the most remarkable creation of Allah SWT is about the human hands, where we know that despite its familiarity, the hands remain an extraordinary masterpiece of design and functions. Through its complex anatomy, precise biomechanics and remarkable versatility, it enables us to perform tasks ranging from the simplest daily activity and to the most delicate surgical procedure. It's indeed a manifestation of the divine wisdom and perfection of creation of Allah SWT, remind us to observe and reflect upon the sign within ourselves and the world around us. Professor Dr. Kamarul Ariffin bin Khalid is our orthopedic surgeon, has devoted more than 30 or 40 years in this field to the study and practice of the hands and about reconstructive surgery. Through his clinical expertise, the scholarly contribution and commitment to teaching, he has impacted countless patients, students, trainees, and colleagues. His work exemplified the integration of scientific excellence, professional mastery, and compassionate patient care. So on behalf of Kuala Medicine, I would like to extend our heartfelt congratulations to Professor Dr. Kamarul Ariffin bin Khalid on this well-deserved recognitions. We are proud of his achievement and grateful for his contributions to our university, our professions, and to our community. Before we begin, I also want to thank each of you for being here today, where your presence reinforced the vibrant of intellectual community that makes IUM such a dynamic and supportive environments. Thank you also to the Secretariat Committee, from the orthopedic departments, from the admin office of Kuala Medicine, and from the office campus director also, who are preparing for this event today. I invite every one of you to listen and after this attentively reflect deeply and engage meaningful with the insight will be given by Professor Dr. Kamarul. Thank you again Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Professor. Ladies and gentlemen, we will now present a video montage dedicated to our honor speaker. Please be seated and enjoy the presentation.
a surgeon, an educator, a mentor, a leader, a husband, a father, a life of service, a legacy of impact. Congratulations, Professor Dr. Kamarul Ariffin bin Khalid, and thank you for your dedication, leadership, and inspiration.
Thank you. We would like to extend our appreciation to the Department of Orthopedic Traumatology and Rehabilitation for preparing such a great video montage. Ladies and gentlemen, I would now like to invite Professor Dato Dr. Ahmad Hafiz Zulkifli, our former lecturer, Department of Orthopedic Traumatology and Rehabilitation, Kuliah Al-Medicine, to present a brief introduction of our speaker, Professor Dr. Kamarul Ariffin Khalid. Please welcome Professor.
Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alamin. Wa salatu wa salam ala ashrafil anbiya wal mursalin wa ala alihi wa sahbihi wa sallim. Distinguished guests, respected leaders of the university and Kuliah, honored colleagues, beloved family members, friends, students, trainees, ladies and gentlemen, brothers and sisters. Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good morning. It is a great honor and a personal pleasure for me to present the biography of our speaker today, Professor Dr. Kamarul Ariffin bin Khalid, on the occasions of his Professorial Lecture. For me, this is not merely a formal duty, it is also a moment of friendship and shared history. I first met Prof. Kamarul in 1985, before the wife met him. At MRSM Kulim, he was doing his matriculations for UKM while I was doing mine for USM. At that time, we were young students with our own hopes, ambitions, and uncertainties about the future. Little that we know then that our path would continue to cross in medicine, in orthopedics, in IIUM, and in our shared journey as academics and colleagues. Today, it gives me a great joy to introduce a colleague whose life story is not only about professional achievements, but also about perseverance, curiosity, service, and a lifelong fascination with the human's hand. Professor Dr. Kamarul Ariffin bin Khalid was born 8th of March 1967 at Hospital Kota Baru, Kuantan, a Kuantan boy but brought up somewhere else. At that time, his parent was working in Besut, Terengganu. However, his earliest childhood memories were not in Terengganu or Kuantan, but in Old Town PJ, Petaling Jaya, before his family moved to Section 11 Petaling Jaya in 1970s. At the age of 4, he attended kindergarten at Tadika Raihan in Section 12, Petaling Jaya, one of the early kindergarten in Malaysia, established in 1967. And remarkably, still operating until today. It was during those early years that the first seeds of his ambitions were planted. His late mother was a registered nurse at University Malaya Hospital. As a young child, he often remembered walking to the hospital to pick up her. Those memories of the hospital environment of service, discipline, care, and compassion had a lasting influence on him. In fact, his ambition to become a doctor began as early as his kindergarten days. His primary education started in 1974 at SRJK Sultan Alam Shah II near his home in Section 11, Petaling Jaya. Even from a young age, he showed leadership qualities and was appointed head boy of the school in Standard 6 in 1979. In 1980, he entered Malay College Kuala Kangsar, one of the most prestigious all-boys boarding schools in Malaysia, where he continued his secondary education until completing his SPM in 1984, same school as the PMX. There is an interesting and meaningful story here. 4 other boys who were with him at Tadika Raihan, who later also went to SRJK Sultan Alam Shah II, eventually joined him at Malay College Kuala Kangsar. One of them is brother Amir Sufyan bin Abdul Razak, who has come all the way from Kuala Lumpur to attend his professorial talk. This is a beautiful reminder that friendships formed in childhood can sometimes accompany us throughout life. After completing his schooling at MCKK, Prof. Kamarul proceeded to MRSM Kulim in 1985 for his UKM matriculation. This is where budak college jumpa Ansara. That was where I first met him. In 1986, he entered UKM's Faculty of Life Science of Faculty of Science Haya in Bangi, Selangor, together with more than 400 students who were competing for a place in medicine at UKM. 6 of his close friends from his time in the Faculty of Life Science, UKM, including one who was also his schoolmate at MCKK, Dr. Mas Adi bin Ahmad, has also come all the way to Kuantan from states to celebrate this occasion and give him their support. Alhamdulillah, in June 1987, he entered the Faculty of Medicine, UKM, near Hospital Kuala Lumpur. Soon after that, he received a scholarship to pursue medicine at the Royal College of Surgeons in Ireland, in Dublin, together with 12 other scholarship students from UKM Medical Faculty. He began his studies there in September 1987, at the time when students had to complete 1 year of pre-medicine classes followed by 5 years of medical school. He graduated from Royal College of Surgeons Ireland in 1993 with the degree of MBBCH BAO. He then completed his housemanship at South Infirmary Victoria Hospital in Cork, Ireland. His early academic inclinations was already visible. In 1994, he became a senior medical demonstrator in the Department of Anatomy at University College Cork. Later, he obtained a Master of Medical Sciences from University College Cork in 1995. This early period in anatomy is important because it foreshadowed much of his later career. Anatomy became not simply a subject he taught, but the foundations of his surgical thinking. In hand surgery especially, anatomy is not abstract knowledge, it is a living knowledge. It is a difference between function and disability, between precision and harm, between restoring a hand and merely operating on one. On 14 July 1995, Prof. Kamarul applied to join International Islamic University. He formally began his service at IIUM on 30th August 1995. At that time, IIUM still at its original campus in Section 16, Petaling Jaya. He was initially posted for his medical officer training in Department of Surgery, UKM, and worked at Hospital Kuala Lumpur before commencing his orthopedic training under UKM in 1996. He completed his training in orthopedics at UKM in year 2000. He went on to obtain diploma in tissue banking from National University of Singapore in 2006, and much later, after many years of service and academic work, he completed his Doctor of Philosophy in Medicine in Orthopedics and Trauma at the University of Adelaide in 2019. Notably, he is among relatively few orthopedic surgeons in Malaysia who hold a PhD degree, reflecting his strong commitment to academic excellence and research in addition to clinical practice. Professionally, Prof. Kamarul's career has been anchored in orthopedics, upper limb surgery, hand surgery, reconstructive microsurgery, biomechanics, bone biology, and medical education. He served IIUM since 1995, almost more than 21 years. Almost 31 years, sorry. Witnessing and contributing to the growth of the Kuliah of Medicine from its early years to its current maturity. Within IIUM, he has held several important academic and administrative responsibilities. He has served as assistant professor, associate professor, deputy deans, and deputy director of information technology divisions. In addition, he played a significant leadership role beyond the academic sphere as a director of IIUM Entrepreneurships and Consultancy, Sdn Bhd, where he also served as chairman of its board of directors, demonstrating his capacity to contribute to institutional development, governance, and strategic directions at the university level. His teaching responsibility has spanned anatomy, orthopedics, traumatology, rehabilitation, biomechanics, research methodology, operative orthopedic surgery, Islamic input in orthopedics, and most significantly, hand and reconstructive microsurgery. In clinical service, Prof. Kamarul has contributed especially to the developments of upper limb and hand surgery services in Pahang. Hand surgery is a demanding field. It requires the eye of an anatomist, the judgment of an orthopedic surgeon, the delicacy of microsurgeon, and the patience of a teacher. It is a field where millimeters matters, where movement matters, and where the outcome is measured not only by X-ray or scars, but by whether a person can hold, touch, write, work, pray, create, and return to life with dignity. Although there are now more than 60 hand surgeons in Malaysia, there are only 2 practicing in the entire state of Pahang, making his role in serving the community here both critical and highly impactful. In Pahang and at IIUM and at SASMAC IIUM, Prof. Kamarul has carried this responsibility with commitment. He has trained students, medical officers, postgraduate trainees, and future specialists, often in a setting where the needs for hand surgery expertise is far greater than the number of available specialists. One of his major contributions has been in postgraduate orthopedic education. Prof. Kamarul has involved in developments of the Master of Orthopedic Surgery program in Kuliah of Medicine IIUM. The program was endorsed by the Kuliah in 2006 and commenced its first batch of trainee in 2008. In 2012, the program received accreditations from Malaysian Qualifications Agency, MQA. Since then, he has supervised and co-supervised numerous postgraduate students in orthopedics, medical sciences, and health sciences. Beyond IIUM, his contribution to orthopedic education has reached the national level. He is currently a board member of the Orthopedic Specialty Committee, OSC. He is the head of National Orthopedic Curriculum Subcommittee under OSC. He is also an advisor to the selections for postgraduate orthopedic training subcommittee and a member of subspecialty subcommittee for educations in upper limb and microsurgery under the Medical Education Committee of the Malaysian Medical Council. Importantly, he has served as the chairman of the National Orthopedic Curriculum Committee for its inceptions in 1995 until the publications of National Postgraduate Medical Curriculum Committee, NPMC, Orthopedic Surgery Training in 2021, which is now the standard curriculum used by all 8 universities running the orthopedic surgery training program in Malaysia. In addition to these national roles, Prof. Kamarul has repeatedly demonstrated leadership at the level of professional training and continuing medical education. He has served multiple times as chairman of Organizing Committee for Good Clinical Practice, GCP workshop, tendon repair workshop, and numerous other academic and surgical training events, reflecting both his organizational leadership and his commitment to advancing standards of practice and education among clinicians and trainees. In this role, Prof. Kamarul was not merely a participant, but a central architect of the curriculum's evolutions over more than 2 decades. He led extensive consultations with university, training hospitals, professional bodies, and regulatory authorities to ensure that the curriculum reflects both international standards and local healthcare realities. Under his leadership, the curriculum was transformed into a structured, competence-based framework that clearly defined learning outcomes, surgical competencies, assessment methods, and progressions milestone for trainees. He championed the integration of workplace-based assessment, logbook standardizations, and continuous formative evaluations, ensuring the training moved beyond time-based apprenticeship to outcome-driven education. Furthermore, he played a role in harmonizing training standards across institutions, reducing variability in training quality, and ensuring that all orthopedic trainees in Malaysia are assessed against a unified national benchmark. His effort also strengthened the alignment between undergraduate exposure, postgraduate training, and subspecialty development, creating a more coherent pipeline for producing competent orthopedic surgeons. The 2021 National Postgraduate Medical Education Committee Orthopedic Surgical Training Curriculum stands today not only as a document, but as a national framework that continues to shape how orthopedic surgeons are trained, evaluated, and entrusted with patient care across the country. These roles are not merely titles, they represent trust. They represent national responsibility. Through curriculum development, workplace-based assessment, postgraduate supervisions, and examination work, Prof. Kamarul has helped shape how future orthopedic surgeons in Malaysia are selected, trained, assessed, and entrusted with patient care. His academic and scholarly works reflects the same breadth. His publication and book chapters span hand surgery, orthopedic trauma, biomaterial, tissue banking, bone graft substitute, bone biology, biomechanics, rehabilitation technology, and medical education. He has contributed to international book chapters, including works in orthopedic trauma, tissue banking, and bone graft substitute. His research has included hydroxyapatite bone graft substitute, bone remodeling, oocytes, cartilage tissue engineering, tendons and hand injury modules, and technology-enhanced healthcare education. His online academic presence can also be traced through his ORCID record, Web of Science author record, Scopus author ID, and Google Scholar profile. For younger academics in the audience, this is a reminder that university career is built over time through clinical service, teaching, writing, research, mentoring, and quiet discipline of repeatedly contributing to knowledge. lagi 2 page. Prof. Kamarul contributions has also been recognized through awards and appointment. He has received research awards at the university and national level, including recognitions for work related to granulomas, a made in Malaysia bone graft substitute, as well as award for research quality and promising research achievements. He has served professional bodies such as Malaysian Orthopedic Association and Malaysian Society for Surgery of the Hand, and has contributed as reviewer, examiner, assessor, and curriculum leader. In more recent years, another dimension of his academic journey has emerged, strongly the integrations of technology into medical education. This is not surprising to those of us who know him. His interest in computers, digital learning, simulations, and education innovation has been present for many years. It is therefore fitting that on the 29th December 2025, he was appointed chairman of the Anatomy Digital Instruction Lab Committee, Kuliah of Medicine, effective from 30th December until 30th June 2027. This appointment symbolically brings his journey full circle. He began his early academic career as a demonstrator in anatomy in Cork. 3 decades later, he now leads a digital anatomy initiative in IIUM, bringing together anatomy, surgical education, technology, and the future of medical learning. Ladies and gentlemen, brothers and sisters, when we look at Prof. Kamarul's journey, we see several themes coming together. We see a young boy born in Kuantan and brought up in Petaling Jaya, walking to University Hospital to meet his mother, already dreaming of becoming a doctor. We see the second schoolboy who became head boy and later a student of Malay College, Kuala Kangsar. We see the young medical students who moved from UKM to Dublin, then to Cork, and eventually returned home to serve Malaysia. We see the anatomist who became an orthopedic surgeon. We see the orthopedic surgeon who became a hand surgeon. We see a hand surgeon who became an educator, researcher, curriculum leader, mentor, institutional leader, and organizer of a numerous national workshop and training program. And today we see the professor whose life work has come together in this professorial lecture entitled The Human Hand, from Divine Design to Surgical Mastery, Reflections on Biomechanics, Surgical Practice, and Medical Education. This title is very appropriate. The hand is not only an organ of function, it is an organ of expression, service, worship, healing, work, craft, creations, and compassion. In many ways, Prof. Kamarul's own career has been shaped by the hand. By studying it, operating on it, teaching about it, researching about it, and using it as a gateway to understand both the beauty and divine creations and the responsibility of surgical mastery. Prof. Kamarul's legacy, therefore, is not only in his curriculum vitae, it is in the students he has taught, the trainees that he has supervised, the patients whose hand function he has restored, the program he has helped build, the workshop and the training event that he has led, and the national curriculum he has helped shape. On personal note, I'm honored that the friend that I first met as a young matriculation student in MRSM Kulim has traveled such a meaningful journey. Today I stand here not only as a colleague, but also as someone who has witnessed part of the journey with admirations and respect. On 30th March 2018, he married Associate Professor Dr. Hazrina Abdul Hadi, an outstanding academician in her own right at the Kuliah of Pharmacy. She has been a constant source of strength, understanding, and encouragement throughout his demanding career, providing balance and perspective beyond the hospital and university walls. Together, they were blessed with a beautiful daughter, Keisha Humaira, binti Kamarul Ariffin on the 6th of August 2022. For Professor Kamarul, his wife and daughter are not only a source of joy, but also his greatest motivation. They remind him daily of the deeper purpose behind his work, to serve with sincerity, to strive for excellence, and to build a legacy that his family can be proud of. In many ways, his dedication to his profession is intertwined with his commitment to his family as he continues to pursue his career with renewed meaning, guided by love, responsibility, and gratitude. Distinguished guests, please join me in congratulating Prof. Kamarul Ariffin on this important milestone. May Allah subhanahu wa ta'ala continue to bless him with health, wisdom, sincerity, and strength to contribute to IIUM, to orthopedics, to hand surgery, to medical education, and to the Ummah. With that, it is my great honor and privilege to present to you our speaker for today's Professorial Lecture, Prof. Dr. Kamarul Ariffin bin Khalid. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Professor. Ladies and gentlemen, it's my great honor to cordially invite Professor Dr. Kamarul Ariffin Khalid to the stage to deliver his lecture entitled The Human Hand from Divine Design to Surgical Mastery, Reflection on Biomechanics, Surgical Practice, and Medical Education. Please welcome Professor.
Thank you very much to the MC. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Alright. Not showing the slides. Okay. Bismillahirrahmanirrahim. First of all, I would like to thank the university for allowing me this opportunity to give my lecture. I would like to welcome the distinguished guests to my lecture. We have quite a number of people here. First of all, my dean, Professor Dr. Aznan Mat Aris. And then to my colleague, Professor Dr. Samsul Rahman, a member of the Board of Governors, to Prof. Dato' Ahmad Hafiz Zulkifli, my longtime friend and colleague, and I would say partner in crime in orthopedics. Okay. My head of department, Dr. Ahmad Fazli Sulung, Dr. Iskandar, who's presenting the campus director, Prof. Jamaluddin, who's not here at the moment. I think he's cycling somewhere in the world, right? Okay. Then we have also Dr. Marzuki, who was the deputy dean at one time, and now he's the deputy director of SASMEC. Correct? He's the medical director of SASMEC. Former, all right, okay. Things change, all right. And then also I would like to welcome one of my mentors coming all the way from Australia, Professor Edward Tetma, and his wife, Dr. Jin Zhang. Right. Thank you very much, and also to my colleagues from the Department of Orthopedics who are here, from my other departments, friends that I knew from my younger years, from my MCKK days are here, from my RCS days are also here, right? And then staff and students of the university. Right. So the title of my talk is The Human Hand, from Divine Surgery Design to Surgical Mastery. It's a reflection on the biomechanics, surgical practice and medical education. I'm now the senior consultant in orthopedics and hand surgery in Sultan Ahmad Shah Medical Center under IIUM. And I respectfully give this talk with knowledge in mind, precision in hand, and purpose in the heart. So the human hand, right? I would like to invite you to reflect upon it as one of the most remarkable creations in the human body, right? We all know and we all use our hands, but maybe we sometimes do not appreciate the importance of it. And also its beauty. So it's a lifelong exploration of the human hand, its design, biomechanics, and lessons for surgery and education. My talk will encompass all of this, and this lecture traces a journey from revelation to anatomy, from surgery to mentorship, and from education to innovation. So it begins with the Surah Al-Qiyamah 3 to 4 that says, "Does man think we cannot assemble his bones? Nay, we are able to put together in perfect order the very tips of his fingers." As a child, I was thinking, as a student, I was thinking, we are talking about the fingerprint. Everyone's fingerprint is unique and very fine and precise, but it is more than that. The divine blueprint looks also at the precision of the hand, like I said, the unique fingerprints, but also the rich tactile receptors and fine motor control that it has, the order of the bones, tendons and ligaments that are arranged for the harmony of movement in the hand, and the purpose, because the hand serves knowledge, care, creation and human connection. So studying hand mechanics is more than studying structure. It is studying the meaning expressed through function. We look at Fibonacci series, or the golden ratio. This was introduced way back in the year 1202, right? Hundreds of years ago. If you look at the number, the subsequent number is equal to the sum of the previous two numbers. So 0 and 1 is equals to 1, 1 and 1 equals to 2, 1 and 2 equals to 3, and so on and so forth. And if you look at this, it forms perfect squares that, and what we call the Fibonacci rectangles, right? And it goes round and round. And if you look, the lines connecting, going through this, forms something like a spiral, and it is actually a spiral. Okay. And that spiral is called an equiangular spiral. The tangent angle is the same throughout the whole spiral. Why is this important? Because this is what nature has in abundance. It is what we in IIUM says a divine creation. So Fibonacci relationships appear in natural growth, from shells and flowers, to the proportions and motion of the weather and galaxies. So storm front has a equiangular spiral, when seen from space. And that's the Milky Way galaxy seen by the Hubble telescope. So you see it in nature, you see the geometry, you see the function, and proportionality creates economy of structure and also efficiency of motion that is mirrored in the hand. So nature designed with mathematics in mind, and this is what we say divine creation. Right. So when a finger flexes, it follows the spiral, the equiangular spiral. It does not simply fold, it traces a curved path that brings the fingertip towards the palm with remarkable efficiency. You look at the form of the bones, they are proportioned for predictable alignment. You look at the motion, the tendon excursion creates control arcs for the movement of the fingers. And you look at the function, the grip that you can do with your hand emerges from geometry and soft tissue balance. So you look at the mechanical system of the bone, of the hand. You have the 27 bones, 34 pulleys, 34 muscles and the complex pulleys. And if you look at the sensory system, we have a high tactile density and precise feedback. It has the highest sensory organs in the whole body, right? And if you look at the motor representation and sensory representation of the hand, it is disproportionate, right? In the brain, the amount of brain that controls the hand in both motor and receives sensation from the motor is much larger compared to anywhere else in the body. And the hand is a communication tool. You use it to make gestures, use it to write, and you also have a language based on the hand. And the hand is an instrument of creation, where in surgery, in arts, in craftsmanship, it is how we perform our daily activities. So all of this comes together to show you the beauty of the human hand. So like I said, we are using the hand for touch and perceive, to grasp and build, to write and communicate, to heal and serve. To lose the hand function is to lose part of independence, work, the ability to worship, and human expression. So functions of the human hand is mechanical, sensory, communicative, and aesthetic. Mechanical for grip, pinch, power, dexterity, and tool use. Sensory for touch, temperature, vibration, and proprioception. Communicative for writing, gestures, sign language, and prayers. And aesthetic for identity, expression, care, and craftsmanship. So a hand surgeon must understand all these dimensions, because restoring anatomy alone is not enough. So my journey in hand surgery, as mentioned by my colleague and friend, Prof. Dr. Ahmad Hafiz, began in 1995 when I joined the Kuliah of Medicine. At the time, the only other staff in the Kuliah was the Dean, the founding Dean, Prof. Mat Tahir Azhar, and his secretary, Madam Zuraida. Right? So I did my Masters in Orthopedics in UKM and became an orthopedic surgeon in the year 2000. I finished my upper limb and microsurgery fellowship in 2009, and then in 2019 I received my PhD from the University of Adelaide. And now I'm working as a hand surgeon, educator, curriculum leader, and also innovator. So hand surgery in Pahang is an important part, dimension to what I'm doing, because it not only I look at the service, but also the responsibility and the purpose to leave a legacy behind. With in IIUM and SASMAC, I'm the only qualified hand surgeon at the moment, unfortunately, and there's only 2 qualified hand surgeons in the whole of state of Pahang, and one of them was my mentor, my graduate and protege, who has since left for the private practice. So every case in the clinic and theatre becomes a platform for service development and capacity building. So injuries reveal design. You understand function of the hand actually to dysfunction. For those who are not looking at hand injury, you may not see how the hand actually functions, right? An X-ray will only show you the bone, but you have a lot of ligaments that you don't see on the X-rays, and this is unfortunately missed quite often. So fractures, ligament disruptions, tendon injuries, and nerve compression tells us how the hand was designed to work and how it fails. And as a surgeon, we must read injury as altered biomechanics, not just as symptoms or signs. So looking at the hand function and anatomy, right? And when we come to anatomy, you also need to look at functional anatomy, where structure becomes movement. We look at the bones, joints, muscles, and nerves. Hand anatomy is not a list of structures, it is a system of relationship between these different structures within the body. The bones as a stable lever for movement, the joints to control the axis of motion, muscles to generate the force and also maintain balance, and nerve for the motor control and sensory feedback. Right, pulley system. As a hand surgeon, this is what we look at every day, but for others, they may not be aware of it. Flexor tendon extension is important for you to be able to curl your fingers according to the Fibonacci relationship, as I mentioned before. And with the pulleys, it maintains the proximity of the tendon to the bone, so you get the full extension. If there's injury to the pulleys, you get bowstringing. And I've seen far too many cases that the pulley was not repaired and patient has problems with their grips, with their grasp and grip. And then the thumb CMC joint, this is where mobility meets stability. Opposition is the foundation of precision grip, power grip, tool use and craftsmanship, and also civilization. The difference between us and the apes are our opposable thumb. And the saddle joints dual concavity and convexity makes the thumb both mobile and stable. Right? The wrist is another engineering marvel, where precision is brought out through balance. Right? When you have a pain after a fall with no fracture, please remember that a normal X-ray is not the end of the story. Persistent wrist pain despite normal radiograph should raise suspicion. For scapholunate injury, where you get radial-sided wrist pain, grip weakness, delayed instability, lunotricutal injury, where you get ulnar pain, instability and subtle signs, TFCC tear, where you get ulnar-sided pain, clicking and DRJ symptoms, and occult fractures of the scaphoid, triquetrium, or any other couple injury that was missed on the initial views. So teaching this message to GPs and the medical officers and trainees prevent months of unnecessary pain. This is what I've been telling my trainees over the years. Right, carpal instability spectrum is subtle, and it looks at the subtle anatomy and the significant disability, which is a spectrum by itself. You get scapholunate dissociation, lunotricutal injury, dynamic instability and chronic collapse. And carpal instability is not a single diagnosis, and the diagnosis sometimes change when you follow through the patient. Those who've been through the posting with me, the trainees will know this, or have seen this. The TFCC injury and ulnar-sided wrist pain is also something that is fast becoming common knowledge. Prior to these, people are not really aware of it. The TFCC stabilizes the distal radio ulnar joint and transmits load across the ulnar wrist. When you get symptoms and you do your examination, you'll be looking at the structure and what might be damaged. And if you're not a hand surgeon, please refer to a hand surgeon, especially when the symptoms are persistent, because they do need to have a specialist look at them. Right? Do not leave them to suffer for months on end. Right? So my academic journey shaped two parts of my academic identity: clinical and scientific. It taught me to connect the operating theatre with the lab and the laboratory with education. And with my PhD, it forms the foundation of my scientific journey. Bone regeneration is not an abstract science. It is the biological basis of reconstructive surgery. Bone defect healing graft host integration, scaffolds and osteoconductive matrices, and mechanotransaction at the cellular level. And you look at bone healing, the biological cascade behind reconstruction, from inflammation to repair to remodeling and integration. So it looks at mechanical stability, biology and time must align for successful healing to occur. And so how does bone biology guides my everyday decision from science to surgery, right? So as a surgeon, I need to understand that biology can plan beyond fixation, need to go towards regeneration and restoration. My journey as an educator, mentoring future generations, started in year 2000 and is still ongoing after 3 decades. So the first graduating class of the MBBS students was in 2002, and each class represent knowledge passed forward from one hand to another. Right. And by 2024 we have almost 2,500 graduates, and this lecture is not only about personal achievement, it is also about the cumulative effect of teaching, mentoring and serving an institution over time. So generation of students have now become doctors, and many of them have also become specialists, and many of them also become teachers. The master's program that I helped build with my colleague and friend, Prof. Dato' Ahmad Hafiz, started in 2008. We look at clinical training, subspecialty exposure and professional formation of the trainees. And this program became a foundation for shaping orthopedic surgeons who serve Malaysia. Under the national curriculum that I lead, we standardize orthopedic training across Malaysia, as mentioned by my friend. In 2021, the curriculum came out. I was the chairman since its inception in 2015. And with the curriculum coming out, a unified national postgraduate orthopedic curriculum was introduced, and it looked at competency-based training, workplace-based assessment, entrustment concepts, and global benchmarks for training the future orthopedic surgeons. For the universities, it became a common standards across the program. For trainees, it gives them, provide them clear expectations and progression. For trainers, a structured supervision and assessment benchmark, and for the country, a national coherence in specialist training. Competency-based training, we now goes away from just attending to become a specialist to be entrusted to be a specialist. We look at the entrustable learning activities within the curriculum, the workplace-based assessment, and the global summary. The question now changed when we teach the next generation of surgeons from have they completed the rotation to can they be trusted to perform safely. So we want to change them from just having skilled hands to also becoming thinking surgeons. Technical ability must mature into judgment, reflection and responsibility. From bone biology to innovation, research become a bridge to future surgical education. From my PhD science to biomaterials and simulation to digital anatomy and AI supported education. I plan to actually have a demonstration of AI in hand surgery with my collaborator in Australia, Mario, but unfortunately I think he's now getting on a plane to go to Sydney for an important meeting. So we had a demonstration, rehearsal yesterday, but we can't proceed with it today. It is something that I hope to show to the audience and to those who are looking at this lecture online. The ability for the AI to converse. You all have seen the Marvel movies, you all know about Jarvis and Iron Man. You have yet to meet Maya. Right? She literally does talk back to you, and the beauty of it, she can tell you medical and clinical knowledge based on all existing knowledge in medicine. right? And she can converse to you at your level as a lay person, as a medical student, as a trainee, or as a surgeon, right? So hopefully we'll have another opportunity for that at another time. So with AI, from information access to guided learning, you can plan your lesson and do the curriculum mapping. You can explain anatomy and pathology. You can reflect on the structured reflective writing and feedback, and you can assess the workplace assessment, evidence, and learning analytics. So technology, however, is not a replacement for the teachers. It is an amplifier of good teaching, right? And I hope that in the future IIUM can be a leader in this. So the anatomy, the digital instruction laboratory, if we can have a demonstration of that. All right, we're looking at digital anatomy, simulation, and surgical education, and I hope to be able to demonstrate that live here. Lim, can we? Yeah, we can show. You know, right. So I have one of my trainees and my fellow lecturer colleague, Dr. Wan Salahuddin, in the anatomy dissection hall. So I can be collaborating with them wherever I am, whether in the hospital or even out of the country. So I can actually use current technology to look at start up the anatomy table over there, the anatomy dissection hall, right? To look at cadavers, right? And I can choose whatever I want to talk about. So I can collaborate with an anatomist in the dissection hall to tell students, whether undergraduate or postgraduate, about anatomy. Right? And I can move the image however I want, right? And look at structures, right, and point out to structures within there, right? So this is just a demonstration to show you what technology can do nowadays. And Adil, the Anatomy Digital Instruction Laboratory, is the first of its kind in the country and probably in the world actually, from what we understand from the makers of the table, Natamage. Others are using the table standalone. We can use one table to teach 150 students at one go, right? So very much different than what it used to be 30 years ago. Okay, thank you very much, Fahmi, Sola. So the future orthopedic surgeon, from a traditional surgeon, you should be looking at becoming a digital surgeon. From just having the knowledge and skill and values, you also need to understand simulation, AI support, and data for evidence-informed progression. So the future surgeon must be technically competent, reflective, ethical, and digitally fluent. With this, traditional excellence will be enhanced digitally. So in summary, my journey in surgery, education and innovation looks at clinical excellence in hand and upper limb surgery for complex reconstruction and service for IIUM and SASMAC, and also the state of Pahang. Educational leadership since 1995 with the university, with the master's program and the national curriculum. Innovation and vision with my PhD, the Anatomy Digital Instruction Laboratory, and AI supported surgical education. So 31 years at IIUM, from building foundations to shaping the future, and each milestone represents not only personal growth but the progress of an institution, a program, and a profession. And no surgeon's journey is walked alone. I have hands that shape my journey, my mentors, Prof. Tahir Azhar, as I mentioned, the founding dean of the Kuliah of Medicine, and Prof. Emeritus Muhammad Abdul Razak, previously from UKM. He was my supervisor when I was doing my master's. Mr. Ranjit Gill, who's now in Pantai Hospital. I hope he's here looking at this through YouTube Live. He was the surgeon that taught me when I was doing my hand surgery posting in HKL under Dr. Pak Menaden back in 1998. So he is one, they all are my motivators and my mentors. Then came Prof. Tedma. I worked with him for 1 year. We did over, I lost count, I think it was almost 200 surgeries with him, right, over in Adelaide. And then my supervisors for my PhD, Prof. Gerard Atkins and Prof. David Finlay. And then my students and trainees, right, some have been to my home. Others only see me in the hospital because I'm running around all the time. And finally, my family. They are my main motivators, and these are the hands that have shaped my journey throughout the 30 years. So in final reflection, the hand represents knowledge, service and responsibility. Knowledge is an amanah, a trust, carried through every patient we treat, every student we teach, and every surgeon we shape. With that, keep that knowledge in the mind, precision in the hand, and purpose in the heart. It's a personal academic motto that I hold in my heart. And I would like to thank you for listening to me rambling on up here, with gratitude to my patients, my mentors, my colleagues, my students, trainees, and finally my family. So the surgeon's hand is guided by knowledge, strengthened by skill, and purified by intention. That's a personal quote that I would like to share with you today. Thank you again.
Thank you, Professor Dr. Kamarul Ariffin Khalid, for an inspiring presentation. Ladies and gentlemen, another round of applause for our professor. Now, I would like to invite Assistant Professor Dr. Iskandar Bahari, Assistant Campus Director, accompanied by Professor Muhammad Azlan Mat Aris, to the stage to present token appreciation from Kuliah of Medicine. May I now invite Associate Professor Dr. Ahmad Fazil Sulong, Head of Department of Orthopedic, Traumatology and Rehabilitation, College of Medicine, to the stage to present a token of appreciation. Thank you, Professor. Ladies and gentlemen, as we celebrate this significant academic milestone, it is fitting that we acknowledge the unwavering support from the families throughout Professor Dr. Kamarul Ariffin Khalid's distinguished professional journey. In recognition of this, may I invite Professor Dr. Kamarul Ariffin beloved wife, Associate Professor Dr. Hazrina, to join us on stage and present a token of appreciation to Professor Dr. Kamarul Ariffin as a symbol of her love, appreciation, and pride in his accomplishment. Thank you, Professor Dr. Hazrina and their beloved daughter. Ladies and gentlemen, we will now proceed with a group photo session. Please kindly remain on your place. We will take a photo from the stage.
Assalamualaikum, audience. Can you please rise? Because our photographer will take a photo from the stage. Just remain on your place. Thank you. Prof, please, please. I hope the crowds are at the back to move forward, please. Distinguished guests, ladies and gentlemen, this brings us to the end of today's event. On behalf of organizing committee, I would like to express our sincere
gratitude of your presence and for making this event a truly memorable one. We hope to see you again in our next professional lecture. Let us end this event with recitation of the Tasbih Karafah. Thank you, everyone. All right. The refreshments are served outside the hall. VVIP guests are invited to the dining room next to this hall. Thank you, everyone. Thank you, Prof.